Got it. All right, thank you. We're going to start in a matter of seconds. Just want to begin the Instagram live video. All right, good morning. And welcome to today's discussion on the Seinfeld episode, The Gum. So from our perspective as clinical healthcare workers, any particular character or scene that caught your eye that you would like to discuss this morning? You need not be prepared to discuss it through the proverbial psychiatrist lens. Anything that you want to talk about character, just describe to me what you saw.
I thought George this episode was pretty, I guess, interesting because he basically has a lot of signs of having a nervous breakdown.
Can someone give me an example of George and what they saw with regard to his looking as if he was going to have a nervous breakdown? Let's see if we can process this.
He seemed paranoid and was kind of blaming everyone else for what was going wrong.
Okay. Again, can you give me an example?
He was blaming his car breaking down on Pop, and then blaming, I think, the guy with the hose for some reason, another reason about his car being stuck. So it was like everyone else's fault but his.
So at this point, we're focusing on the character of George Costanzo, and we're focusing on different scenes that appear to have a common thread where, and then common meaning pervasive, distrust and even suspiciousness of others. And you've identified this with regard to Pop as well as the store owner as evidence of George's thoughts and or behaviors being pervasive. So if that's the case, what is one of the first things that pops up in your mind with regard to a potential diagnosis if what you've observed causes clinically significant distress or impairment? When I tell you that there is pervasive distrust and suspiciousness that is clinically significant, what is in your differential diagnosis? Well, let me ask you, if you were taking an exam and there were only two choices, A, the differential diagnosis would likely be a mood anxiety spectrum, or choice B, be due to a psychotic dissociative spectrum. A or B, what do you think is going on here? Make it simple. Pervasive distrust and suspiciousness, AKA paranoia. Mood or psychosis?
I would say psychosis.
Yeah, I agree. That's a great place to start. And, I think there's a major teaching point, not necessarily with regard to, again, potentially pathologizing behavior, but the way clinicians have to think. Take it one step at a time in going through that process, going through that algorithm, often referred to as case formulation. We all know already, the interns have been here for several months, that not all paranoia is due to psychosis. As a matter of fact, the very way the American Psychiatric Association provides guidelines to work up paranoia and psychosis in general is to first rule out that it's not due to an underlying mood disorder. But despite that, the easiest way to think this through is that if one is paranoid, the clinical suspicion is going to be a psychotic dissociative spectrum. And even though you take that first step, then you're reminded of the American Psychiatric Association categorization in nosology, meaning that we always must think mood disorder first, right? Even though the presenting symptom is psychotic. In George's case, and you've heard me say this pertaining to this character multiple times, he is the best character ever scripted with regard to teaching psychiatry because he defies that artificial categorization. So what we're going to talk about with regard to George today is going to be different than what we discussed pertaining to George in last week's episode. I believe that was the opera, and going to be different from the differential diagnosis that we discussed for George Costanza last month and the month prior to that. He allows for really a broad discussion of mental health. And I think when we focus on the word pervasive, we understand that there are parts of his behavior that we have to identify. And when we do, we also see that it's very stable, that this suspiciousness is not only pervasive with regard to it crossing social situations at any one point in time, AKA an episode, but it's also stable over time. We see this as a very constant trait in George throughout the entire 9 seasons of the situational comedy. And when we begin to identify the pervasiveness and the stability of these symptoms, the idea of a personality disorder, I think now comes into context. Again, the review of this is that even though that is something you identify, hearing the words stable and pervasive, we have to be reassured that what we are seeing, again, pertaining to this episode, is not due to an underlying medical condition, is not due to the direct and physiologic effects of a substance, nor is it due to another mental disorder. And assuming we've evaluated for that and we have ruled that out, we can look at the paranoid personality disorder as something that is demonstrated through the character of George Costanza in the episode The Gum. Any ideas with regard to 2 other personality disorders that clinicians usually think about when they discuss the paranoid personality disorder, that is, other conditions that tend to cluster signs and symptoms with paranoid personality?
Would it be schizoid and schizotypal?
Excellent. Right, those are the 2. Right, those are the 2. And in each case, we often see people socially distant. Right? We often see people socially distant. If the clinician is able, the reason why they are socially isolated, be it physically and or emotionally, usually allows for focus on one of those 3 cluster A personality disorders. If the social distancing, and I know that phrase takes on a completely different meaning in 2020 and 2021, but for the psychiatrist, that distancing is due to a pervasive distrust and suspiciousness. We're talking about the paranoid personality. You can see how somebody who has that level of distrust is probably not going to readily engage in social interaction. That's the paranoid personality. If it's due to the individual simply wanting to be alone, to avoid interpersonal relationships because of their comfort level being in isolation, that's very likely the schizoid personality. And if it's due to an eccentricity of behavior or some bizarreness, it's likely the schizotypal personality, right? So the reason why the individual is socially distant helps the clinician identify one of those 3 pathologies. Again, these are the cluster A personality disorders, each of which does confer some risk to developing a future psychotic illness, including but not limited to schizophrenia. Right. So again, this quick primer, ultra quick primer, all from the observation that George has an adverse or maladaptive interaction with both Pop as well as that store owner. Anything else about George Costanza in this episode you'd like to discuss?
He seemed to have pretty significant delusions, like going more than just mistrust, but his being convinced that the woman stole $20 from him, and then her showing up everywhere, seeing her on a horse. We know, like, as an audience, that it's all sort of just unfortunate circumstances, but to the woman that he was with, it sounds like he's going crazy and just seeing this woman everywhere. And he's also, I guess, delusional about Lloyd. He keeps coming up to like, oh, he's the reason why this didn't work out. The woman even says, oh, so it all comes back to Lloyd. Yeah, so pretty significant delusions, I think.
So your observation is that George appears to demonstrate fixed beliefs. And even when confronted with information or provided information to the contrary, his beliefs remain fixed and therefore rigid. And if that's the case, and they are not reality-based, and they do cause clinically significant distress or impairment, then most clinicians will use the phrase or the clinical term delusion. And it's interesting that we see this behavior in George because we've already provided evidence that he is demonstrating signs consistent with the paranoid personality disorder. And that very personality disorder, that cluster A pathology, does confer risk for a psychotic illness that itself would be defined through delusions. So I don't know if that was something that was actually intended by Larry David, but certainly it is evidence-based. It is consistent with what we understand with regard to the etiology of psychosis. Again, I reassure you that in prior episodes, in multiple prior episodes, as well as future episodes, there is not necessarily the appearance of psychosis in this character, but once again, George Costanzo, the character, provides a wealth of information that allows these types of discussions. What are the different subtypes of a delusion, or often referred to as themes of delusion? We already have one, purgatory, and that seems to be the one demonstrated in this particular episode, the gum. What are the others?
Jealous, and grandiose. I remember those two.
Jealous, grandiose, along with persecutory. Two more.
I'm not exactly positive on the pronunciation, but erotomaniac is
Good enough.
what I thought.
Erotomania, good. And the final one is somatic type. Somatic type. All right, so again, we could see these themes in multiple contexts. That is, an individual who is delusional can simply have one of these themes. Of course, you could have multiple themes, so you would have a mixed type of delusion, or you could have none of the above. Again, people's behavior sometimes defies the easy categorization, the oversimplified categorization of the American Psychiatric Association. So certainly unspecified delusions are also diagnosable. But here I think we're looking at persecutory type, otherwise referred to as paranoid type. Right, so any other observations with George? Any other characters you'd like to discuss this morning? We're halfway through our discussion. This is Psyfeld, focusing on the clinical discussion of the gum.
One more thing that I thought was, I guess, notable about George was the fact that he took so much pleasure in gossiping about Lloyd and his breakdown. Like, that was the first thing he wanted to do when he saw this woman that he hadn't seen in a while. She even takes note of it, like, I wouldn't be, so happy about this. I think he even said, like, I think it made him feel better because his parents had always compared him to Lloyd when he was younger, so he feels like he's better than him now.
Yeah, I think you're exactly right. So again, the observation is that George does seem to take pleasure in the suffering of Lloyd Braun and what happens to him. And we could talk about the different etiology, but because I think even in this episode, some information is provided. That is, if as a clinician, this came to our clinical attention, I think we would have a fair assumption as to where to begin probing and asking more questions. But I want to approach this in a more general manner. We talked about this before with George Costanzo, the character. What or where do you think this comes from? Again, and trying to avoid the specifics of his early childhood experiences, especially his relationship with his parents.
Low self-esteem.
Yeah, right. So we'll call it low self-esteem, and that's it. And again, in the context of this character, what we had previously discussed is this sense of an external locus of control. George is absent that internal locus. He is absent that self-esteem. So the way in which he feels good, the way he experiences a sense of well-being is not with regard to any positives pertaining to himself, because he does not have an internal locus of control, but otherwise a negative experience of outside of oneself. So not plus for me, but instead negative for you. And that really does focus on that external locus. And I think that's really what's guiding this. Now, having said that, again, that's basic social learning theory. And there's much more, there are many more details to provide here as to why. Why would George Costanza have an external locus of control? And that answer gets to his early childhood relationships and those initial primal relationships that he forges with his parents. Right? And we've kind of addressed those before, and don't have to really get into any further detail this morning. Any final thoughts on George Costanzo or any other characters you'd like to discuss from the episode The Gum?
I thought Kramer's behavior was interesting in this, how he was trying to do everything he could to protect Lloyd's feelings, especially with telling him that Jerry wears glasses, and then Jerry had to continue wearing these ridiculous glasses just so Lloyd, I guess, wouldn't have a breakdown, if that would somehow make him have a breakdown. But then I was thinking more into it, I think Kramer's motives were also very selfish because he needed Lloyd for the theater. So he was kind of doing this for himself, maybe didn't really even care about Lloyd's feelings.
Yep, I agree with you. Kramer does demonstrate behavior that is very interesting and ends up being clinically impactful. So when we look closer at this, remember, anytime we observe behavior, I would like you to train your brain as to thinking that it is normal, right? Even though within seconds, 100% of individuals who are observing this behavior would quickly say, no, it's not. Just a way as a mental exercise to provide unconditional positive regard to people. Always acknowledge, well, this is normal until it's proven not. And whether that proof comes in 1 second or 1 year, it's a great way to address different clinical scenarios. Having said that, while I think, again, when somebody appears to be altruistic and helping others, the idea here would be, well, why isn't this just normal behavior? And it is, until proven otherwise. We do see further detail with regard to what's happening. And certainly there does appear to be a motivation that we didn't acknowledge or we didn't uncover when we first observed what Kramer was doing with regard to his relationship with Lloyd. And that was restoring this theater and what it would take and how he needed Lloyd to do just that, given Lloyd's connections. All right, so now we're looking in further, and the type of things that he does with regard to ensuring that Lloyd doesn't react in a way that would derail this is something that we have seen on multiple occasions from Kramer. I mean, he has these objectives and he has these different types of plans that most people would not undertake. Now, that is not to say that if an individual tries to restore a marquee theater, that somehow that's mentally ill, far from it. But with regard to the repetitive nature of Kramer always engaging in these types of activities, we have to think that there's something going on here, especially when his engagement results in clinically significant distress or impairment. In this way, people now with a broader scope, looking at this character of Cosmo Kramer through the perspective of 9 seasons, would or might use clinical terminology as being eccentric or odd. And when we hear that, we do think of the schizotypal personality. And so George, I think in this episode, demonstrates that pervasiveness with regard to distrust and suspiciousness, the paranoid personality, and Kramer provides evidence of another personality disorder within that same cluster, that odd, eccentric behavior that is consistent with, albeit not diagnostic of, the schizotypal personality disorder. Right? Again, and each would confer risk of a psychosis. I think the other interesting thing here, if you allow me to take the next leap, is that the psychosis, or the discussion of psychosis, then even expands to the character of Lloyd Braun himself. Because number one, we do know that he has a past medical history. And even though I think it's referred to as a quote unquote nervous breakdown, nobody really knows what that is. Nobody really knows what that means. And it can, because it can mean or it could be taken in the context of multiple things, including a psychotic break. And when we see at the end of this episode, or towards the end of this episode, that Lloyd Braun observes an unbuttoned or a lost button on Elaine's blouse, and he interprets it in a very personalized manner with regard to what she was trying to communicate to him. That is a potential sign of psychosis. Anybody have a guess as to what that sign is called?
Is it called the egocentrism at all?
No. It's the personalized significance an individual might impart to a neutral stimulus. It's called an idea reference. An idea of reference, otherwise referred to as delusional misidentification, right? Delusional misidentification. And I think that term is probably more important because it's more descriptive. Anyone who interacted with Elaine after her altercation with that store owner would have identified that, yes, it is reality-based to observe that she lost a button on her shirt. Everybody would agree, every viewer, millions of viewers who watch this episode would also agree that in fact is reality-based. When an individual imparts personalized significance to that in terms of what it means to them, or in Lloyd Braun's case to him, that is the delusional aspect. So delusional misidentification is rather descriptive with regard to what's happening in this scene. The other clinical term is the idea of reference. Right? And in either case, we're talking about a type of delusion, an example of delusion, which itself is a sign of psychosis. So the way this episode shapes up, we have one character, George Costanzo, who demonstrates the core feature of the paranoid personality disorder. We have another character, Kramer, who demonstrates core features of the schizotypal personality disorder. And along with the third cluster A personality, called the schizoid personality, also for developing future psychosis. And that future psychosis, I think, is also wrapped up in Lloyd Braun's character, in as much as, number one, we know that he has a past psychiatric history, and number two, that past psychiatric history likely has everything to do with a psychotic disorder, as evidenced by his imparting personalized significance to a neutral event or stimulus, aka the delusional misidentification, otherwise known as the idea reference. I think it's a very quick summary of the gum. Only a couple minutes left this morning. Any other final thoughts on what you saw in our Seinfeld episode?
I thought it was just really interesting how obedient Jerry was throughout all this, like listening to Elaine going to the front and then wearing the glasses and then wearing the worst glasses. Like he didn't comment or anything, even when he's lost like $100.
Yeah, I think that's a valid observation. Jerry certainly was not one of the main characters in this particular episode. He just seemed to go and along with everybody else and was quite passive. And again, that may have been by design in terms of kind of allowing this episode to be about people other than the character, Jerry Seinfeld. But again, in the absence of any strong character traits that would allow us to identify something, might the clinician deem that as a pertinent negative, right? That is, might the absence of anything observable, might that itself be an observation? And that's that pertinent negative. Due to timing, I'm not going to go any further to discuss what that pertinent negative might actually be, but only to introduce that as a twist with regard to this particular episode. Again, most clinicians look for signs with regard to allowing for a diagnosis as well as a differential diagnosis. And certainly in psychiatry, pertinent negatives are perhaps just as important as pertinent positives when formulating an individual's diagnosis. Right. So I'll leave that at that. We'll end it there. Coming up at the bottom of the hour. We'll be back. I'm going to make an announcement later on this morning, especially for the Abnormal Activity crew, because it is the last Friday of our medical student rotation. We may look to merge both events later on this morning or around 12:30. Time to be announced. Let me get together with those on the service to get an idea of how we're going to structure our morning, and we'll make sure we text the correct interns to post it on Slack as to what our plans this morning will be. Again, there's a potential to combine abnormal activity and Night's Watch today due to patient flow and the medical students taking their final exam today. So to be announced, stay tuned. Otherwise, either way, I will see you later.
Thank you.